Добрый день, глубоко уважаемые коллеги. Гости объявляют...
Good afternoon, dear colleagues, dear guests. We're having technical break number 1.
кончилась.
Dear colleagues, technical break number 1 is over. Good afternoon, dear colleagues. Today is the 1st of October 2021. It's 3 p.m. Moscow time. We're beginning the session of the Dissertation Council for the Defense of the Dissertation by Evgeny Penkovoy, Assessment of Periodontal Tissues in Obesity Patients. Under the order issued by the Academic Secretary of St. Petersburg State University, Professor Gnotov, number 5197/1, I, Professor Natalia Sokolovich, Doctor of Medical Sciences, Professor of St. Petersburg State University, have been appointed the chairperson of this Dissertation Council. The other members of the Dissertation Council have been appointed by the same order. They are Professor Sergei Ulitovsky, Doctor of Medical Sciences, Pavlov, St. Petersburg State Medical University, Professor Sergei Fishev, Doctor of Medical Sciences, St. Petersburg State Pediatrical Medical University. Some members of the Dissertation Council are participating in the session remotely. They are Professor Yuri Madai, Doctor of Medical Sciences, Professor of St. Petersburg State University. Professor Madai, can you hear us and see us? Yes, I can hear you and see you. Thank you very much. The research supervisor, Professor Lyudmila Yermolaeva, is also here. She is a Doctor of Medical Sciences. Professor Madai, please switch off your microphone, but please don't forget to switch it on when you are asked to read out your report. This session of the Dissertation Council is being recorded and broadcast on the website of St. Petersburg State University, and the session is being interpreted into English. You can ask your questions and make comments about the dissertation using the email address that you can find on the official website. This will allow you to participate in the academic discussion. The technical personnel will refer the questions to me and I will read them out during the discussion. The questions are supposed to be relevant to the contents of the dissertation. The authors of the questions are to write down their name, position and workplace. The questions which are not relevant to the contents of the dissertation or anonymous questions will not be read out. Under the relevant order issued by St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University, this session of the Dissertation Council is duly constituted, provided at least 2/3 of the members of the Dissertation Council members are present. The total number is not to be fewer than 4 people. This Dissertation Council consists of 5 people, 4 of which are present, including 1 member of the Dissertation Council who is attending this session remotely. Therefore, we have a quorum. I would like to ask the representative of the Department for Dissertation Council Management to make an attendance list. The agenda of this session is as follows. The session will last for about 2 hours. Number 1, the chairman's presentation about the documents submitted by the academic degree seeker and their conformity with requirements. The chairman's reply to questions, if any. The academic degree seeker's presentation providing an overview and findings of the research. Questions to the degree seeker regarding the presentation. Replies to the questions. Reports on the dissertation. The council members will be taking the floor in turns. About 10 minutes per person. The chairperson's report on the dissertation. The academic degree seekers' comments about the reports on the dissertation and replies to the questions. Open discussion. The floor will be given to the members of the audience. They can give a brief account of their ideas and/or ask questions about the research. No more than 5 minutes per question. It is necessary to fill in the registration form and give their full name, position and academic title before the talk. Next, the chairperson will read out the questions received via email. Please note that questions which take more than 2 minutes to read will not be read out. Replies to the questions. Presentation of the dissertation supervisor. Deliberations of the members of the dissertation council before the open balloting on conferring or non-conferring the academic degree. Next, open balloting and vote counting and recording the results in the protocol. Making a decision on whether to confer or not to confer the academic degree. The degree seeker's closing speech. Do you have any questions about the agenda? Professor Madai, do you have a question? I don't have any questions. Thank you very much. Let us proceed with the agenda. Please leave your telephones set on silent mode. Professor Madai, please do not switch off your mobile phone so that we can contact you in case of a technical failure. Let us proceed with the agenda. The dissertation by Evgeny Penkovoy is submitted in conformity with the requirements for the academic degree of the candidate of medical sciences. The specialization is 317, assessment of periodontal tissues in obesity patients. The dissertation was approved for the defense by the order of the Academic Secretary of St. Petersburg State University. The dissertation was completed in St. Petersburg State University. The research advisor is Doctor of Medical Sciences, Associate Professor of St. Petersburg State University, Professor Lyudmila Yermolaeva. The academic degree seeker has published 12 research papers. 2 papers have been published in peer-reviewed journals recommended by the Ministry of Education and Science, and 1 research paper has been published in the journals indexed by Scopus or Web of Science. The degree seeker has submitted a full set of documents which are in compliance with all the necessary requirements. The documents are stored in the dossier. The representative of the Department for Dissertation Council Management has the copies of the documents. Before giving the floor to the academic degree seeker, I would like to ask the members of the Dissertation Council if they have any questions to the academic degree seeker, and if it is necessary to read out the list of documents. I don't have any questions. Thank you very much. Now I give the floor to the academic degree seeker. You have 15 minutes. The floor is yours. Dear members of the Dissertation Council, dear colleagues, the topic of my dissertation is assessment of periodontal tissues in obesity patients. The dissertation is relevant because periodontal diseases are quite common, just as obesity and underlying comorbidities. According to the World Health Organization, these diseases lead to disabilities all around the world. we know that periodontal diseases contribute to the decrease of the life standards, and obesity also plays a role here. The purpose of the dissertation is to evaluate the clinical presentation of the chronic generalized periodontitis in obese patients to optimize approaches in the treatment and prevention of this pathology. The specific tasks are as follows: to identify the relationship between the severity of the chronic generalized periodontitis and obesity, to study the relationship between the severity of periodontal pathology and body mass index, to estimate the indices of hem microcirculation in the vascular bed of the periodontal tissues, to study bone density in obese patients, and to determine the influence of the multi-component metabolic syndrome on the periodontal tissue status. The research group included 130 people. 80 people were patients with obesity. The control group included 50 people. The study group was divided into 4 subgroups depending on the comorbidities, which are components of the metabolic syndrome. Subgroup number 1, patients without any comorbidities. Group number 2, patients with arterial hypertension. Subgroup number 3, patients with type 2 diabetes, and subgroup number 4, patients with arterial hypertension and type 2 diabetes. We used the following inclusion criteria: fasting blood sugar level more than 5.6, or type 2 diabetes in the medical history, blood pressure exceeding 130, systolic blood pressure exceeding 130, and diastolic blood pressure exceeding 85. The exclusion criteria are as follows: chronic kidney disease, type 1 diabetes, anemia, pregnancy and lactation, cancer, respiratory failure, and medication that influence bone density, as well as gingival hypertrophy. We conducted the anthropometric examination of all the patients, including waist to hips ratio and different laboratory tests and investigations. We studied the interdependence of the metabolic syndrome and periodontal diseases. To this end, we used Doppler imaging and bone densitometry. The statistical analysis was conducted with the help of the statistical software. Patients with obesity and patients from the control group were comparable in terms of their age, gender, comorbidities, and professional hazards. On this diagram, you can see the number of patients in terms of the degree of their obesity. 51 patients were with the first degree of obesity, 23 patients were with the second degree, and 6 patients were with the third degree of obesity. This slide compares different groups of patients. Patients from the study group had generalized chronic periodontal diseases. However, patients from the control group did not have this disease of a high severity. After that, we distributed all the data according to the body mass index. the degree of severity of the chronic generalized periodontitis is in direct correlation with the body mass index. In other words, the increased body mass index leads to more severe chronic generalized periodontitis. We also studied the blood velocity of patients in both groups. We see the decrease of this indicator in patients from the study group. There was a conversely proportional correlation between these indicators. The increase in obesity leads to the decrease of the blood velocity in the periodontal tissues. We also conducted investigations and lab tests. We did the bone density test. 70% of patients in the study group had osteoporosis, whereas only 18% of patients from the control group had osteoporosis. We also identified a conversely proportional correlation between the following indicators. The increase of the body mass index leads to the decrease in body mass index. Moreover, the analysis also shows direct correlation between the body mass index and the amount of C-reactive protein. In the analysis, we subdivided patients with diabetes into 4 subgroups. Without comorbidities, patients with arterial hypertension, patients with metabolic syndromes, and patients with both comorbidities. We also compared the data between the periodontal tissues and the severity of the body mass, the severity of the obesity. We also identified the dependence between the microcirculation and the body mass index. To this end, we subdivided the patients into 4 groups. The blood velocity is lower in groups 2, 3, and 4. The analysis also revealed conversely proportional correlation. It shows that the blood velocity in periodontal tissues is lower depending on the severity of the comorbidities. To identify the correlation between the body mass index and the bone density, we conducted the analysis. We identified conversely proportional correlation between these indices. Therefore, periodontal tissues in patients with obesity have more disorders than patients from the control group. We need further investigation of the interdependence between obesity and the state of periodontal tissues. However, this fact must be taken into account when prescribing treatment for different patients. Body mass index screening is essential to assess the state of periodontal tissues, as well as regular examination of their periodontal tissues. I believe this will let them decrease the risk of complications. I also revealed a direct correlation between different indices. The number of patients in the control group, the number of patients which had severe disease in the control group was only 20%. chronic generalized periodontitis was among 45% of patients with the body mass index over 30. Hem microcirculation is worse in patients with obesity. The blood velocity in periodontal tissues is lower in patients with a higher body mass index. There is a conversely proportional correlation between the body mass index and bone density.
Подождите.
We identified chronic generalized periodontitis in many patients with comorbidities and with obesity, and this disorder was of high severity. In order to improve the rehabilitation of patients with chronic generalized periodontitis, it is necessary to refer such patients to medical professionals of different specialties. It is advisable for such patients to undergo regular examination at the dentist's at least 1 in 3 months, or 1 every 6 months if the degree of severity of gingivitis is not very high. In order to assess the microcirculatory disorders, it is recommended to use Doppler imaging. Patients with obesity and chronic generalized periodontitis are advised to take bone density scan as well. Thank you. Dear members of the Dissertation Council, are there any questions about the presentation? You can ask your questions, or you can ask your questions after you have read out your reports, or let us ask the questions after the reports. Professor Madai, what do you think? What do you mean? Do you have any questions about the presentation? Yes, I have one question. Would you like to ask it now or after you have read out your report? I would like to ask it today. I would like to ask it now. I would like to remind you that the academic degree seeker can answer for no more than 2 minutes. Statistical methods are quite fundamental. However, I believe that your research is observational. Can you disprove this? Professor Madai, I agree with you. I believe that this research is of observational character. We examine patients with disorders and we try to find a correlation and an interdependence between the status of their periodontal tissue and their body mass index. Are you satisfied? Yes, I am. Are there any other questions to the academic degree seeker? No questions? Professor Litovsky, do you have a question? I have 2 questions. which mechanisms make it possible for abdominal obesity to have an impact on periodontal diseases? Please answer the question. Professor Ulitovsky, the main biological markers of interdependence between obesity and periodontal disorders are not known. However, there is an opinion that hormones and cytokines which are released by the adipose tissues play a role here. Are you satisfied with the answer? I also have another question. The majority of your research deals with the bone density. Why did you decide to study this issue? I believe that the processes which are happening in the skeletal bones have an impact on periodontal tissues, since bone tissues are part of periodontal tissues. Moreover, there is research which shows that obesity and comorbidities such as arterial hypertension and diabetes lead to the decrease of bone density. Thank you very much. Do you have any questions? What are the specific clinical features of patients with abdominal obesity? Patients with abdominal obesity have a high degree of severity in periodontal diseases. The exacerbations happen more often and remissions are shorter. Thank you. I also have a question. Do you believe that it is clinically important, or do you believe it's clinically significant to assess the blood velocity using Doppler imaging? Our research reveals that there's a inversely proportional correlation between the blood density and the periodontal tissues status. Therefore, I believe that this indicator is clinically significant in terms of the treatment strategy and in terms of making a diagnosis. Dear members of the Dissertation Council, I would like you to read out your reports. The floor is given to Professor Ulitovsky. So the topic of the dissertation is assessment of periodontal tissues in obesity patients. I believe that the topic of the dissertation is relevant because such diseases as chronic generalized gingivitis and chronic generalized periodontitis of moderate and severe degree are quite common. 1 in 4 has a high body index or obesity. Obesity has become a pandemic in developed world. High body mass index has an impact on the progression of many diseases, and in many cases this fact is underestimated. As obesity is becoming more common, different comorbidities are becoming more and more common as well. I mean such diseases as coronary heart disease, type 2 diabetes, cancer, arterial hypertension, and some other comorbidities which lead to disability and early and premature death. Adipose tissue is the tissue that releases inflammatory cytokines. Therefore, it is essential to study the impact of obesity on the diseases of periodontal tissues. Early testing and diagnosis of comorbidities will allow to increase the efficiency of treatment. The dissertation has a traditional structure. It consists of 2 chapters. It also contains important research findings and practical guidelines. The novelty of the research. The research reveals the correlation between the clinical presentations in patients with obesity and the tissue and the status of their periodontal tissues. The research has identified the impact of obesity on the periodontal tissues disorders. The research has identified a correlation between the severity of periodontal diseases and the degree of obesity. The research has substantiated the necessity to carry out a comprehensive examination of patients with obesity in order to prevent progression of the disease and to conduct preventive measures. I believe that the research findings are duly substantiated. I believe that the dissertation is very well written. The research findings are credible and valid since the academic degree seeker uses modern research methods, makes a review of research papers, and also makes use of the results of investigations and laboratory tests. The academic degree seeker has made presentations at different international conferences and workshops and has published papers in different journals. The research findings are also stated in the primary medical records. At present, there are many research papers dealing with periodontal diseases and obesity. However, there is not enough research that deals with the interdependence of these conditions. The main research findings are as follows. The academic degree seeker has studied progression of periodontal diseases in patients with obesity. He has identified a correlation between the severity of the chronic generalized periodontitis and obesity. He has assessed microcirculation in the vascular bed of the tissues, of the periodontal tissues. He has assessed bone density in patients with obesity, and he has identified the impact of the metabolic syndrome and each of its components on the periodontal tissues. Moreover, he has studied the periodontal tissues in patients with obesity using Doppler imaging and bone density. Besides, the academic degree seeker has developed a comprehensive treatment of patients with periodontal diseases and comorbidities such as obesity. He has also developed a method of ultrasound Doppler, or rather he has suggested using ultrasound Doppler imaging and conducting bone density scans in patients with obesity and chronic generalized periodontitis. I do not have any major comments or critical remarks about the dissertation. There are some stylistic inaccuracies which do not change the overall positive assessment of the dissertation. I have a number of questions, however. Which preventive measures do you find more efficient for patients with obesity? Please answer the question. Which preventive measures of periodontal disorders do you find most efficient in patients with obesity? I believe it is very important to raise awareness among medical professionals about the clinical significance of obesity in patients with periodontal diseases, namely chronic generalized periodontitis. This is the major area of preventive measures. Moreover, I would like to say that in my dissertation I use such methods as measurement of microcirculation and bone density measurements. These data can also be helpful for developing treatment plans. My second question is as follows. Are there differences in treatment strategies for patients with obesity and patients without obesity? Professor Ulitovsky, thank you for your question. Patients with obesity should be referred to different medical professionals in order to provide a comprehensive approach and in order to control the periodontal tissue status and the comorbidities. Yes, there are differences. Thank you. I would like to continue. The dissertation by Evgeny Penkovoy, assessment of periodontal tissues in obesity patients, complies with the major requirements set forth in order number 6821/1 as of the 1st of September 2016 on the procedure of granting academic degrees at St. Petersburg State University. And the academic degree seeker can be awarded the academic degree of the candidate of medical sciences. The specialty is 317 Dentistry. The dissertation is compliant with sections 19 and 11 of the above-mentioned order. Thank you very much. Dear members of the Dissertation Council, I would like to tell you that all the reports have been posted on the official website of St. Petersburg State University, so you can focus only on the most relevant parts of your report and on the questions and critical remarks. Are there any objections? No, there are no objections. Do you have any objections, Professor Madai? Professor Madai, you are given the floor. Dear members of the Dissertation Council, this is the first time that I have participated in such a session. I would like to say that I have really positive emotions. I would like to focus on the assessment and evaluation of the dissertation. I will not be reading out my report from beginning to end. My overall assessment of the dissertation is positive. The degree seeker has developed a comprehensive approach. I have already asked the academic degree seeker about the observational nature of the dissertation, and the academic degree seeker agreed that his research is of observational nature. He didn't disagree with me. However, he did not employ the full algorithm of biometric study. I believe that this would have eliminated some questions to the academic degree seeker. The academic degree seeker has provided some mean data. I believe that the title of some tables is not correct, but my critical remarks do not change the overall positive assessment of the dissertation. You calculated the dispersion and the mean values. And however, we do not see the dispersion in some of the calculations that you present in your dissertation, but this is a very small critical remark. There are some symptoms which are characteristics of patients with different comorbidities, such as diabetes or arterial hypertension. And then you move on to the correlation analysis very quickly. You identify the interdependence between different parameters and indices. However, you could have moved on to employ cluster analysis. I believe it would have been really helpful for a dissertation. However, this research is observational, but anyway, I would like to say that this is one of the few research papers which identifies the interrelation between the somatic signs and symptoms and periodontal diseases. I, however, couldn't quite understand if the groups were heterogeneous or homogeneous. There is some information relevant to the issue at the end of the dissertation, however. I believe you should have provided more similar data in the dissertation. You focus on the comprehensive analysis, however you do not analyze whether the groups are comparable or not. But at the end of your presentation you emphasized that the groups, namely the control group and the study groups, are comparable groups. However, I would like to say that this dissertation is well written. There is area for further research which can be of applied character. I believe that I will vote in favor of conferring the academic degree. Thank you very much. I give the floor to Professor Sergei Fishev. Dear members of the Dissertation Council, the dissertation by Evgeny Penkovoy is relevant. The number of patients with obesity is increasing in developed countries. I will try to be brief because my colleagues have already spoken at length about the positive aspects of the dissertation. The degree seeker has identified a correlation between the degree of obesity, and destructive changes in periodontal tissues. The dissertation uses enough evidence. The cohort included 130 patients. And at the end, I would like to say that the dissertation by Evgeny Penkovoy, Assessment of Periodontal Tissues in Obesity Patients, complies with the major requirements set forth in the relevant order issued by St. Petersburg State University. The academic degree seeker, Evgeny Penkovoy, can be awarded the academic degree of the candidate of medical sciences, specialty 317, Dentistry. The dissertation is compliant with sections 9 and 11 of the above-mentioned order. Thank you. Thank you very much. I would like to read out the report submitted by Sergei Rubnikovich, who wasn't able to attend the session of the Dissertation Council. So, the report on the dissertation by Evgeny Penkovoy. Professor Sergei Rubnikov is a Doctor of Medical Sciences, Belarusian State Medical University. The overall assessment of the dissertation is positive. This dissertation is a serious contribution to science and to practical guidelines. The research findings show that there is a close correlation between the state of periodontal tissues and obesity. It is necessary to raise awareness among doctors of different medical professions, because it might have an impact on the treatment strategy. The research findings of the dissertation are of practical significance because they're important for treatment and diagnosis of periodontal disorders in patients with obesity. The research findings can also be recommended for further use in different medical centers, and they also can be included in the teaching courses at different medical universities. The overall assessment of the dissertation is positive. However, I have a couple of questions which do not change the overall positive assessment of the dissertation. What impact do periodontal diseases have on the somatic status of the patient? Inflammatory diseases of periodontal tissues may lead to the progression of some somatic diseases of inner organs. It is also possible to say that periodontal diseases also may have an impact on different organ systems. My second question: which method to identify bone density is more effective, ultrasound densitometry or to energy X-ray absorptiometry? The main advantage of X-ray densitometry or ultrasound densitometry is the replicable results, and moreover the procedure does not depend on the experience, on how experienced the doctor is. However, the other method has a lower radiation dose for the patients. Moreover, this method is not very expensive. However, I believe that ultrasound densitometry can be recommended as a screening method to identify bone density. So the dissertation by Evgeny Penkovoy, Assessment of Periodontal Tissues in Obesity Patients, complies with the major requirements set forth in the relevant order issued by St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University, and Evgeny Penkovoy can be awarded the academic degree of the candidate of medical sciences. The specialty is 317 Dentistry. Now I would like to read out my own report on the dissertation. The report is posted on the official website of St. Petersburg State University. So the dissertation is brief, is relevant, because there is no comprehensive approach to treatment of periodontal diseases in patients with obesity. The research findings are credible and valid, which is proved by the use of modern methods. The academic degree seeker has identified specific tasks in order to achieve the overall goal of the dissertation. He has studied the interdependence between obesity and the periodontal tissues state. He has identified the impact of the degree of obesity on periodontal tissues status. So the novelty is beyond any doubt. The structure of the dissertation is in line with the topic and the contents of the dissertation. The author comes to the conclusion that microcirculation in periodontal tissues and bone density is lower in patients with obesity. Moreover, I would like to say that there are some stylistic and grammatical inaccuracies in the dissertation. However, they do not change the overall positive assessment of the dissertation. So the dissertation by Evgeny Penkovoy, Assessment of Periodontal Tissues in Obesity Patients, is a complete research paper which provides a solution to a relevant scientific issue. It allows to improve treatment of periodontal diseases in patients with obesity, and the dissertation by Evgeny Penkovoy complies with the major requirements set forth in the relevant order issued by St. Petersburg State University. And Evgeny Penkovoy can be awarded the academic degree of the candidate of medical sciences. The specialty is 317 Dentistry. The dissertation is compliant with sections 9 and 11 of the above mentioned order. I would like to read out the report, the external report. The report was submitted by Violetta Silver. The overall assessment is positive. The academic degree seeker provides credible research findings. This is a serious contribution to science and practical guidelines. Dear colleagues, dear members of the Dissertation Council, is everybody satisfied with the answers to the questions? I'm not really satisfied. I wanted to have a discussion, but the academic degree seeker agreed with me, but in general everything is okay. Does anybody want to make a presentation? Does anybody want to make a presentation? Please come up to the microphone. You are supposed to tell your name, position, and place of work. Professor Alexander Shishkin, chairperson or rather head of the department at St. Petersburg State University. I would like to say a few words about the relevance of the research. Well, I would like to say that unfortunately more and more people are developing metabolic diseases, and general practitioners face this issue on a daily basis, and I'm happy that dentists are beginning to take into account this fact. The metabolic syndrome has an impact on all the organs and tissues in the body, and I believe that this dissertation focuses on the fact that the condition of vessels, of blood vessels and bone density should be taken into account when developing treatment for the patient. So I suppose that this dissertation was able to provide interesting research findings. And I believe that the academic degree seeker made a very interesting presentation of the research findings. I would like to focus on another issue here, namely the practical significance of the dissertation. I believe that there is no doubt about the high practical value of the dissertation. This dissertation takes into account medical treatment, specific treatment and local treatment. Moreover, the dissertation also provides information about the necessity of prevention. I believe this is an important contribution, and I would like to congratulate the academic degree seeker and the research advisor. Have we received any questions via email? So, are there any questions? We have not received any questions via email. Now, I would like to give the floor to the research advisor. So the floor is given to Lyudmila Yermolaeva. Please tell us about the academic degree seeker and his research. Dear members of the Dissertation Council, dear colleagues, I would like to say a few words about the personality of the academic degree seeker. He is really single-minded and industrial. Moreover, he is loyal to his alma mater. He was admitted to St. Petersburg State University, then he graduated from St. Petersburg State University. He also took a residency course in St. Petersburg State University, and then he took a postgraduate course in St. Petersburg State University as well, and now he's defending his dissertation. The academic degree seeker is quite young, however, his personal qualities are exceptional. His personal qualities allowed him to be the head of the Research and Medical Center at the Institute of Experimental Medicine. Moreover, I would like to emphasize that the academic degree seeker is quite young. However, he's very competent and skilled at being the head of the Medical and Research Center, and the Ministry of Science and Education also awarded him with a diploma, and I believe that the academic degree seeker should be assessed very highly and should be given merit for his achievements. Well, he's quite a modest and well-mannered person. I believe he made only 100 contribution to his research. He made all the calculations. He participated personally in each stage of the research. So the overall assessment is very positive, and it was a pleasure to work with the academic degree seeker. Thank you. Thank you very much. Dear colleagues, do you want to say something about the academic degree seeker or his work or his research? I have already said that this is an interesting research, and I believe that his next research will be dealing with applied aspect of the research. So this is a comprehensive research paper, and my critical remarks do not change the overall positive assessment of the dissertation. I believe that this is a pilot work, if I may put it so. It's a very good observational work. It provides a detailed description of signs and symptoms. So I believe that it is necessary to give cluster analysis of signs and symptoms in the next research paper, and it is important to identify the major signs and symptoms that have an impact on the overall condition of the patient. I believe that this is fundamental research, and I would like to congratulate the academic degree seeker and the research advisor. Thank you. Thank you very much. I believe this is the end of the discussion. I would like to ask the members of the Dissertation Council and the academic degree seeker if they have any questions about the procedure of the session, including any questions or comments about the remote regime of the procedure. Do you have any questions? No questions. This is my first session like this, so I cannot compare it with anything, but I do not have any comments or objections. Now let us move on to the next item on the agenda. Dear members of the Dissertation Council, we can have a technical break in order to discuss the results of this session. Do you think we need a technical break? I don't think so. I think we don't need a technical break. Now let us continue with the agenda. I will ask each member of the Dissertation Council to voice their opinion. So it is 4:14 p.m. Moscow time. Please make sure that the broadcast is on. Let's make sure that we see each other and hear each other. We're beginning the open voting on the issue of conferring the academic degree to Evgeny Penkovoy. The specialty is 317. When you say "I vote in favor," it means that you agree that Section 11 is not violated in the dissertation. This Section 11 states that the academic degree seeker is supposed to make references to all the necessary resources, including references to research papers written by the academic degree seeker or the academic degree seeker and his co-authors. Let me remind you that the decision of the Dissertation Council is positive, provided more than 50% of the Council members have voted in favor. Professor Madai, how do you vote? I vote in favor. Section 11 is not violated. Okay. Professor Litovsky, how do you vote? I vote in favor. Professor Fishev, how do you vote? I vote in favor. Natalia Sokolova, also vote in favor. So, dear members of the Dissertation Council, out of 4 members of the Dissertation Council, 4 people have voted in favor. Nobody has voted against or abstained from voting. So, Evgeny Penkovoy is awarded the academic degree of the candidate of medical sciences. The medical specialty is 317 Dentistry. I give the floor to the academic degree seeker. I would like to thank the chairperson of the Dissertation Council and the members of the Dissertation Council. I would like also to thank my research advisor, Professor Yermolaeva. I would like to thank Professor Shishkin. So I would like to thank everyone. So thank you very much. We congratulate you. This is the end of the session of the Dissertation Council. Thank you very much. Please switch off the broadcast. Thank you.